Okay, this is the hollow hold test to test anterior core strength. There's a lot of different things that this is going to be important for. A lot of times we look at this for individuals who are doing kipping pull-ups, push-ups, things where there's shoulder involvement or lower body involvement, but they're definitely going to need that anterior kind of hard core to kick in for them. So what you're going to do is get on your back, and we're going to have a position to start where our legs come straight up towards the sky and our arms come straight up towards the sky. And what's going to happen in this position is you're going to feel kind of automatically that lower back pressing into the ground. So that's your starting position. What we want to do with this assessment is we want to see how far you can extend the arms and the legs before that lower back changes its original position. All right, so the goal would be to get borderline hovering the ground. All right, realistically, as you start touching the ground, you're probably going to almost have to take on some spinal changes. But if I start with that back relatively flat, as my arms and legs drop, I want that back to stay pretty solid on the ground as we drop. All right, if you find at any point that that back is really lifting off of the ground as you're dropping, then you're going to have that challenge through that hard anterior core like we talk about, in terms of being able to use those muscles to keep your spine in a good position. Specifically for pull-ups, this is going to be a very important thing where we can brace the core. If you're needing to do kipping pull-ups or if you're just doing regular pull-ups, you're going to need to brace that and keep that in a nice solid position to allow the lats and the shoulders to do their job. So give that test a try. And again, a pass is probably if you can get beyond halfway down without that back starting to lose its position. If you find that it's really, really challenging, you're getting pain in your back, maybe pain in your hip flexor, or any other thing that's abnormal along those lines, then we're going to want to work at this a little bit.